I'm Dr. Colin Haines, spinal surgeon, and one of the questions I get all the time when someone has a spinal fusion is, what is a fusion? How quick do we get people rehabbing? And how can you tell things are healing well? Well, in general, what a fusion is, it's when we grow one bone to another, but in the proper position. Now, most of the time this isn't needed, but there are some circumstances where it is, and here's an example of one. Here's a patient who's having a lot of back pain and shooting leg pain because the bones were slipped or had what we call a spondylolisthesis. They weren't in the proper alignment. So for her, what we did is we did a less invasive fusion, meaning I put a wedge, basically an implant in between the L4 and L5 bones, which you can see right here, as well as screws to help support the load. Now what this did, it stopped that abnormal motion, it took the pressure off her nerves, took care of the back pain, has gotten her back to living her life. So these are her x-rays at the 2-week mark. At 2 weeks, we're still in that recovery phase. Her skin's healed up at this point, her muscles are a little bit irritated, but much better. But overall, her bones are not fully healed yet. Bones grow gradually with time. It's kind of like if you cut your skin. Initially, you get a scab that's formed, and gradually things heal up and become skin under that scab. Well, the same principle happens with the back. Early on, we put bone graft in these implants. We put these implants and help hold it in place so that the body turns this area into its own bone. At 2 weeks, we don't see any sign of that, nor would I expect to see that. So at that 2-week mark, we have people basically start working with physical therapy and doing some of their normal day-to-day, like routine walking. We have them avoid the BLTs. And what I mean by BLT is no bending aggressively at the waist, no twisting hard, and then no lifting more than approximately 10 pounds. So the BLTs is what we really look for. Now, gradually progressing with the muscles with physical therapy, then we come to 3 months after surgery. Well, 3 months after surgery, as long as people are feeling good, which almost all the time they're feeling good at this point, and the x-rays look reassuring, which they certainly do, is the point that we start gradually lifting those restrictions. So the BLTs go away, but acknowledging that the body's, we've taken things a little bit easy with the muscles, it's a gradual return to normalcy. What we see on the x-rays at this point, we see some additional healing of the bone. So while this cage is so densely metal that we don't see the bone form through the center, we're starting to see some wisps of bone forming around the cage. Basically, when we know that there's bone forming around the cage, we know it's forming through the center like crazy. Well, now is the point where we can start letting people get back to their lives a bit, bending and moving around, which highlights what we come up to the next point. At the 6-month mark, we're seeing continued maturation of the bone. The screws are all in place, and we're seeing more evidence of maturation, or that wispy bone starting to heal through, kind of like a scab that's finally turning into true skin. Now, there are things we look for, which we see evidence of bone forming, but there's also things we don't want to see. We don't want to see these screws wobbling. If the screws are wobbling, it's a sign that the healing's taking place a little bit slowly, or the things aren't healing in the proper way. But here, we're already seeing that. Everything's healing up, and we're not seeing that abnormal toggling of the screws. And lastly, at a year mark, this is where we really see in her additional healing of the bone. We're seeing that maturation of that bone, where it used to be more wispy, now it's really filling in like mature remodeled bone. Just like before, not seeing any wobbling in the screws. Unfortunately for her, completely pain-free. She's back to hiking, cycling, swimming, running, and really enjoying life and traveling with her husband. Now, one thing that's helped, in my opinion, we did the right surgery for her. We did it in the most effective, least invasive way that maximizes healing rates. But a big part of this is the partnership. She's been very diligent. We've had a wonderful dynamic. There's a lot of discussion with your surgeon. When you're having these aches and pains that come after surgery, it's important to know, hey, is this normal? Is this part of my normal recovery? Or is this something I should be concerned about? Well, fortunately, she's been very diligent. We've had a wonderful partnership. And I think that's why she's had such tremendous success, not only that she's healed, but she's healed in the proper orientation with minimal muscle disruption, and she's been feeling great the whole time. So.